Time now for this week's Health Matters with PA Lynn Szabo, Paul Critz on this end. And we're discussing, this is kind of pervasive. This is all over the place out there, right?
Anemia. Yeah. It's I think, an important topic, and I'm hoping to drop some pearls on the audience. So
that implies the audience is swine.
No, not at all. This is that's a medical term. When a less experienced provider is talking to a more experienced provider, they oftentimes ask for pearls. And what that means is clinical insights that are going to be like, whoa, didn't see that coming.
Alrighty.
So, and the reason I want to talk about it is it's super common. It's being talked about right now, but patients will oftentimes mistake bruising as a sign of anemia.
Really?
And they will oftentimes think that the only anemia is iron deficiency anemia. So I'm just hoping to open the understanding.
To which I retort, there are other kinds of anemia?
Yes,
I did not know this.
There are, and we shall talk about them. So anemia is roughly defined as a decreased amount of hemoglobin. So hemoglobin's the molecule that carries oxygen in the bloodstream. And it's the whole point of taking a breath. Having the blood go through your heart and then go to your brain or your muscles or your kidneys or someplace that needs it to function. Okay. So it's an energy carrying capacity, kind of in the most fundamental sense. So
an energy carrying capacity. I don't want to get too much into like the molecular biology here, but so is that so carrying the oxygen? It's an energy thing. That's what it's providing energy or the ability to metabolize.
Think
things?
about it as like us driving around. Okay, so I have to go to the grocery store. What do? I get into the car,
right?
Typically, and then drive there. So it's the little cars that are going through the bloodstream. And it's also problems with anemia and hemoglobin are the most common blood type of diseases or hematologic diseases. And it can happen, people can develop problems with it suddenly, say, postpartum hemorrhage, so bleeding after having a baby, or it can be kind of slow over time. So say an elder that has a undiagnosed cancer, that's affecting how red blood cells are formed.
Okay.
And it's so to that point, it's oftentimes the presenting symptom of other disease, which is kind of the take-home lesson, one of the pearls that I want to lay on you. And nobody should ever assume that they have iron deficiency anemia if they have evidence that it might be something else, because taking iron willy-nilly can
be bad too, right?
Toast your liver. And there actually is a nurse in Humboldt, not up here, who's telling people that are anemic to automatically go to iron, even though that could be dangerous information. So I'm kind of worried that patients are getting the wrong story on this.
Okay.
So when I look at how blood cells, and it's not just red cells that have hemoglobin in them, but also platelets, the cells that clot blood, or white cells, the cells that help with our immune system. When I see how that system works, I look at the bone marrow, and I see the bone marrow as kind of a factory that's making those cells. And the factory can have problems because they don't have resources coming in.
Sure.
Like iron, like vitamin B12, like folate, or they have a problem in the factory, taking the resources and making them into, the product that they're trying to make, or they can have a problem after the factory when there's a problem with the product either getting to where it's supposed to be or being destroyed for some reason as it leaves the factory.
Wow, okay.
Does that make sense?
Sure.
Okay. So in the resource department, that's where iron deficiency, folate deficiency, and B12 deficiency are. So iron deficient anemia is what people commonly think of, but there's another kind of anemia called pernicious anemia, where for some reason the B12 is not absorbed from the diet, either because it isn't there because somebody's an absolute vegan,
Okay.
or somebody's had stomach surgery, or somebody's just aging and they don't have the receptors in the stomach to pick up B12. And then so they start to get anemia, but it has a particular pattern. So we're able to figure that out with some diagnostic insight. But people present with really vague symptoms, like they're tired. You know, there's like only a gazillion things in medicine.
Yeah, right.
Yeah.
But is checking for anemia, I mean, that's part of your typical blood workup, right?
Yeah, but not necessarily checking for obscure kinds of anemia.
Oh, okay,
so
okay.
There's clues in a regular CBC, which is a complete blood count, which is a reflection of how the factory is working.
Right.
So how the bone marrow is working. And we can tell whether, the red blood cells are way too tiny and don't have a lot of hemoglobin in them, or whether they're like huge and pale, which would be a B12 deficiency.
Okay.
So there's a finesse in the diagnosis, and people need to understand that all anemia is not iron.
Okay.
So production problems would be bone marrow problems like aplastic anemia, which is when your bone marrow just cuts out on you and like all done, going home.
Oh my God. Okay.
Yeah, and so people don't live very long. And there's a lot of reasons why it might happen. So again, specific diagnosis, super critical here. Or chronic kidney disease.
Right.
So people would be like, what
No,
do the kidneys have to do with the bone marrow? Well, the kidney is like blood pressure fine-tuned. And they're the ones that put the hormone out that signal the brain to signal the bone marrow to make more red blood cells.
Really?
Yeah.
Okay, so before that, I've got, like, my wife has chronic kidney disease, and she's on top of her numbers, her blood cell numbers, and goes from like being and this will be a pearl for her, because she was saying, ask Lynn about this. I get this before I walk over. I said, oh, we're going to talk about anemia. Okay, ask her about. She goes like, it's frustrating for her. She's either like iron deficient anemic, and then all of a sudden too much iron. It's like really hard for her to land in the sweet spot.
So it might be actually a problem with erythropoietin, which is the hormone that the kidneys make that try and get the system to either make more red blood cells.
Right.
And, for somebody, let's say that has cancer, and perhaps they're not making enough red blood cells, this is actually a synthetic hormone and injectable if people need that.
Wow.
But it has to be understood first. You don't just go injecting it into people, because then you can there's things with too many red blood cells. That's a disease too.
Okay.
And so, she might ask her physician to do some more studies to understand it better. But, the kind of anemia that comes from kidney disease is called, it's kind of broadly grouped in a category called anemia of chronic disease, which is, I don't know,
it's kind of teleological, kind of like defining itself.
Like, really? What does that really say?
Yeah, thanks.
And so, and all the iron in the world, or all the B12 injections in the world, are not going to solve that problem. The solution is solving the kidney issue as much as can be done. So another problem is, and I remember said, in the destruction of red blood cells, that can be like bleeding. Okay, so you're in some heinous accident and you bleed out. That can be something called hemolytic anemia, which is where for some reason the immune system attacks the red blood cells and breaks them open.
Yikes.
I know. That's a hard one. So there's a lot of reasons that would cause that.
What sort of reason would cause that?
Probably an autoimmune disorder.
Okay,
Yeah.
right. Your body's attacking itself.
This gets super complicated.
Yeah.
So, and the other thing is there can be combinations of problems. So there can be problems at the factory with abnormalities of hemoglobin production that are genetically kind of driven, like sickle cell anemia or spherocytosis. And then what that happens to those people that have that is that they are they're putting out red blood cells that are not made right, and the spleen is going, oh, defect, off the line. And they're taking too many off the line.
Is that what the spleen does? Yeah. One of the things? Is it quality control?
One of the things the spleen does is quality control.
Okay.
Yeah.
And so the marrow isn't producing robust enough red blood cells for whatever needs to happen?
Yeah, usually they're not normal shaped.
Okay. Like the sickle cell?
Yeah.
Yeah.
And oftentimes these people with sickle cell will actually get their spleen taken out to get that problem solved.
Oh, wow, really?
Yeah.
Oh.
Yeah, super common.
Huh.
So you see it's complicated, and I think the answer for one problem is not the answer for all problems.
Sure.
And that's the message that I want to take home. Symptoms of anemia are kind of nonspecific. So fatigue, of course, is a big one. Dizziness. Mm-hmm. So like when people go from lying to sitting to standing, they'll get dizzy. If it's really severe, it can cause chest pain or shortness of breath. And the shortness of breath is super specific. It's what we call dyspnea on exertion and not so much shortness of breath. That means you don't lose your breath until you move around.
Can you say that again?
Dyspnea on exertion.
Oh, okay. All right. I thought that was one big word. Okay, cool.
No,
I was going to learn a new word.
Yeah.
Dyspnea. Okay.
Dyspnea on exertion. So you're either SOB or DOE. And, there can be a lot of causes for all of this. People are super pale. So this is the classic urgent care presentation of a slightly elderly man who comes in and like glows in the dark. And maybe they're there because they need to update their tetanus shot because they stepped on a nail. But you can't get over the fact they look like Casper the Friendly Ghost.
Okay.
And then oftentimes you can get a CBC and find out they're super anemic for one reason or the other.
All right.
Usually that's an occult cancer. That goes back to anemia of chronic disease. And this is the other pearl I want people to take home. No matter what the old wives say, bruising is not a symptom of anemia. It could be a symptom of aplastic anemia, but that's a different thing than iron deficient anemia.
What's the interplay between red blood cells, anemia, and blood pressure?
Well, there's a lot because it goes back to the kidneys. If the kidneys feel like they're not getting enough red blood cells or enough oxygen carrying that's going through it, they will put hormones out that up blood pressure.
Okay.
And so, if that system is out of whack, then the kidneys will be saying, higher, and then what's happening is the blood is being forced through these delicate little tubules in the kidneys, and it's damaging them.
Okay. All right.
So the kidneys are trying to do a good thing, but eventually there's a point where it becomes a bad thing. So now, if you're worried, if you're looking at your bruises on your forearms right now and you're like, but my grandmother said, and you're worried, how am I going to tell him anemic? You can look at your fingernails.
Oh, okay.
Fingernails have a lot of interesting changes. The little white spots are not symptoms of anemia. That's the other thing.
Okay. I've never heard that either, too.
Yeah.
But just anywhere in the okay, the little
the nails. You can get all kinds of changes in nails, and providers hardly ever look at fingernails, but they tell great stories, and they mostly tell stories that have been going on for a while because it takes a long time for your nail to grow out from a cuticle bed to where you can see it.
Okay.
But people with anemia have ridges, and they have really thin, and their nails will break. Wow. Yeah.
So, I mean, the surface of the nail will be like ridgy? Is that what you're saying?
Ridgy.
Like vertical ridges?
Yeah, like a rippled potato chip.
Oh, wow. Okay. Yeah. All right.
and
I think everybody out there listening is looking at their fingernails right now. I am.
No. Mine are okay. They're also kind of pale, but that goes along with people being pale everywhere. Right. So go online and look at your fingernails and see if you can find anything that identifies an illness with a nail that looks like yours. So the next thing is how is hemoglobin measured? So there's a few different ways. It can be measured directly out of the bloodstream. So they can draw a CBC, which is a complete blood count from your arm, okay? And then, they can go ahead and run it through the little machine and get that information. So, but they also look at things called hematocrits, and that's what the blood bank does. But the hematocrits have more error in them than hemoglobins do. So in medicine, we have something called an acute phase reactant, and we argue about what is actually an acute phase reaction and reactant and what isn't. And so what that means is, what's the first clue that something's going wrong in this person? And so hemoglobins, they say, don't always change even after somebody's had an acute bleed where they've lost half their blood volume. Their hemoglobin might still be the same. And hematocrits will change. But when in my research, actually, for this program, they said that they said to look at ferritins, that ferritins are the acute phase reactant. So that's the first clue that there's a problem. Okay. So hemoglobins and hematocrits are not necessarily the best test to look at, but it's the one that we commonly use.
How do you look at ferritins?
That's just another blood test. So if you're drawing blood off somebody, kind of weird to think if somebody doesn't have enough red blood cells, the first thing you do is take more out. But ferritin that's part of the reason I'm doing this topic today, because there's the medical community is now all abuzz about ferritin. So I attend lectures that are done by physicians that are retired but are still masters in their field. And so recently attended one that was done by a urologist who had practiced out of OHSU, and he was talking about how, because anemia is a big deal, anything with kidneys. So he was talking about how his hematology friends prefer to see a ferritin instead of a hematocrit or a hemoglobin. So ferritin directly measures it's the storage protein for iron, and can be used to measure hemoglobin indirectly. So even though it's an iron thing, there's formulas that you can plug it into, and you can actually get a good idea of what somebody's hemoglobin is. Obviously, most useful to look at iron deficiency anemia, but also useful to get a number quickly that suggests that something is not an iron deficiency anemia. So remember,
So to eliminate that.
Lab work oftentimes rule things out too. Okay. And I think that this could be used, and probably should be done routinely on pregnant women and multiple times during their pregnancy. We're just talking about that now at UHS, but I think almost anybody that comes in and says, I'm bruising all over the place, my grandma says I'm anemic, can you do the blood tests? This is now the blood test that I would pick.
Okay. Yeah.
So,
what sort of anemia do the pregnant women suffer from?
They got a couple of different ones. Oftentimes they have a resource problem with not enough iron or B12 going in.
Just because of things being diverted to the baby, to the fetus?
But they also have a dilutional problem, because what happens is, specifically hematocrit is kind of it's a percentage that looks at the amount of red blood cells compared to the plasma volume. Plasma is what's in blood that's not red blood cells.
Right.
So you're kind of looking at a proportion. And their thing is they get more plasma, so all of a sudden they have a dilutional thing. And they become anemic because of that.
Wow, all right.
Which is a problem because, you're growing a human. So,
you got it.
So finding anemia early in pregnancy and correcting for it, super helpful. I won't say they're too thrilled about taking iron, because that can cause, stomach upset and constipation. But if you're supposed to take iron every day and you really can't tolerate it, try taking your iron with a vitamin C rich food.
Really?
Because that will improve your uptake of the iron, so you can do more with less, which will help with side effects, which is usually horrible constipation.
Ooh.
Yeah, not very fun. Treatment also depends on the diagnosis. This is important. Again, this is a take-home message. Find out what it is you really have. Okay? Go to the doctor, get diagnosed, address the problem in a way that makes sense. Sometimes it has to happen fast. Like, for example, I saw this patient once in Humboldt County who was kind of a beloved homeless person, but unfortunately had a big alcohol problem and had constant internal bleeding. Ooh. Where he was pooping out blood a lot. And I think that was a couple of decades ago when it was snowing. He happened to come into clinic, and so we did our thing, and we finished up, and he said to me as I was leaving, "I'm having problems with chest pain and losing my breath." Oh. And I went, you know, yeah. Turned around, came back in, got a hemoglobin on him. His hemoglobin was 3.5. And so he was immediately hospitalized, taken to the hospital by...
Which should it have been? I don't know what 3.5
Oh, sorry, 3.5. For an otherwise healthy male, probably 13.5.
Oh, yikes. Okay.
So he was down like 3/4 of his blood volume because he was slowly pooping it out.
Oh, wow.
From an intestinal bleed. So if he had... And that night it snowed and it was intensely cold in Arcata. So if he had done his usual thing and been sleeping, you know, under a bridge somewhere, he probably would have died.
Oh my God.
Because he was already having it affect his heart. Mm-hmm. So, and then he spent that night and many more after that in the hospital until they were able to stabilize him.
Well, good for him.
Yeah. He got good care.
Yeah, that's nice to get out of the elements like that.
Yeah, so, like every human being should have.
Right, anyway. As a right.
Yeah.
So is there so affecting heart and breathing? I mean, once you affect the heart, you're going to affect the breathing, I assume, with the whole time.
Right, that's why he was presenting with shortness of breath.
Is it a volume issue in that regard? Okay.
Part of it.
What other facet of anemia could affect heart?
Oh God, there's like so many. You mean like...
I guess, and what other... I mean, I understand the volume and the interplay. It's a very simple thing to understand. Volume and the interplay, blood pressure and heart.
If you put kidneys in there, like we've already talked about, if the kidneys are cranking up the blood pressure because they feel like they're not getting enough hemoglobin, that can also have an effect on the heart.
Right?
It's not a direct effect. Because it causes the heart. So what makes blood pressure go up? Well, the heart has to beat with more force. So the heart's a muscle. So if that muscle is, I guess, being exercised,
being like taxed because it's being exercised out of...
Then the muscle is, two things are happening. The muscle is thickening and it has a increased metabolic demand. So the coronary arteries, can they bring enough blood to that muscle to keep it going? Maybe not. Maybe they're narrowed because of a lifetime of Big Macs or something,
right?
Or genetic predispositions or a gender. There's a lot of reasons. Then you're setting yourself up for an MI, really, which is myocardial infarction, aka heart attack.
So that, I guess that you answered my question in that what is the mechanism that why is it bad for the heart? And because if the heart is the mechanism itself that's being kicked in some sort of out of bounds unreasonable response to something because of an issue,
and the heart needs hemoglobin and oxygen delivered to pump effectively. So if somebody's anemic, then that's not going to happen.
Wow.
If somebody has a dilutional anemia, like a pregnant woman would, then they're going to have problems oxygenating their heart just because number one, the heart's working more, right? Yeah. And number two, there isn't as much fuel to keep that pump going.
Right.
There's all kinds of things. It kind of depends on, again, we come back around. What is the actual diagnosis and address that pathology first.
Right. So is anemia itself, I mean, this is kind of a basic sort of question, and as was my heart question, but anemia is never going to be the diagnosis, right? It's always going to point to something else.
One would hope. Yeah, but it's really common right now. You have 7.5 minutes in an exam room. It can be really common to just
treat the anemia. I'm sorry,
right.
I
not
cut you
look
off.
Not look at this in the detail that it needs to be looked at.
Right.
And I think as providers, we strive to do that. And we're lucky in this community. I don't say that very often, but we're lucky to have a hematologist in this community. Okay. So a specialist who studies blood, and how to take care of blood disorders. So it has been known in this community that iron deficient anemic people who for some reason couldn't get enough iron into their diet, maybe they were intolerant of it, actually get it intravenously, which is not, particularly safe thing to do. There's all kinds of complexities associated with it. And so it's good we have a hematologist who can provide that kind of care.
Just because, so if you take it intravenously, just because it's not coming in the usual way, it's not going through the metabolic process or something, it's just kind of a direct line in, so that could be,
You can have allergic reactions to it mostly. But...
Wow, okay, so let's go over the pearls again. What are you hoping that the listener takes away today from this discussion of anemia?
That with all due respect, your grandma was wrong. So excessive bruising to me sounds more like a platelet or a blood clotting issue and not so much a red blood cell issue.
Right.
So you can tell me that you're worried that you're anemic because you bruise a lot, but in really I'll just sigh and then I'll address the problem in a way that makes medical sense. So the next thing is anemia. Does not all the different types of anemia, and it's complex. They are not treated with iron, so don't go rogue and just take iron and think you've solved that problem because it's not safe. Taking unnecessary iron can toast your liver, and that's a bad organ to have mad at you.
And it can build up just in organs in general, right?
Right.
Can't it? Yeah. Wow. Okay.
And then the other thing is make sure that your provider. And hopefully that provider will explain to you a detailed understanding of what is actually wrong with you, because there's so much more than just iron deficient. And none of it's going to go away until you address the root cause. Okay. So for example, an alcoholic, really common that they get B12 deficient, so that's not going to go away until the alcoholism is fully addressed, even though we can inject people with B12. So make sure that your provider is ordering tests. And the new test that's in vogue, ferritin.
Okay.
Wow, that's really helpful. So yeah, being in an exam room and you hear, oh, you're anemic, then the first question is, what kind of anemia?
Yeah, what does that really mean?
Yeah. Wow. Okay.
Yeah.
Thank you very much. That was a whole bunch. That was really cool. I learned a lot.
I thought that was cool too. I like it when they have these hot topics in medicine. All of a sudden, I see them everywhere, and then I think it makes sense to bring it to the show.
Right on, exactly. So, any thoughts about next week?
No, but I do want to say Open Door was scheduled to have their homeless clinic behind the Superette today, and it was called off due to it being a holiday in the Open Door system.
Okay,
so Open Door itself will be closed tomorrow.
I want to be very clear about this.
Yeah.
This will air Monday and Friday.
Okay.
So.
Right. So also, they're not open
today.
Monday.
Yeah, there you go. Today, all right.
Yeah.
Because I don't think anybody's going to be open tomorrow.
Yeah,
right?
and if anybody's grumbling about no acute care, no homeless clinic, and no regular clinic on Monday, it's because it's a president's holiday for them. UHS, open on Saturday, open on Monday, because they're not as enamored with presidents.
Yeah, there's a lot of reasons why they might
They
not.
have different holidays that are, more meaningful to them.
Oh, that's beautiful.
So,
good. Okay.
Yeah.
All right. Well, cool. Well, Lynn, thank you very much. I look forward to next week.
Yay.